Okay, well, welcome everyone. For those of you who do not know me, I am Pazartasa Regan. I am Program Manager at Catholic Climate Covenant, and I want to welcome you today to this Feast of St. Francis webinar, Catholic Healthcare Sows Hope and Action for Creation. We are excited to be co-hosting this webinar today with Catholic Health Association of the United States. Last summer, while planning a webinar on plastics, I'd originally invited U.S. Catholic healthcare systems to present about their plastic reduction strategies. And in my conversation, it became apparent that uh, the U.S. Catholic healthcare sector was doing work much broader than solely plastic reduction. So we got inspired to bring you to this conversation regarding the depth and breadth of how U.S. Catholic healthcare has responded to Pope Francis's call in Laudato Si to hear the cry of the earth and the cry of the poor. Luckily, Indu Spugnardi with Catholic Health Association enthusiastically agreed, and we are delighted to be collaborating with her on this webinar. Before we get started, we do have what we call our housekeeping slides. The session is being recorded, and a link to the recording will be sent to everyone who registered within the next 24 to 48 hours. We ask that you submit your questions in the Q&A box and not in the chat. The chat is for you to discuss things between yourselves, but the questions should be in the Q&A box. If you know which panelist your question is directed to, that will also be very helpful. We also ask that you should keep the chat very civil in your interactions. If somebody starts becoming a little bit uncivil, I may be needing to come in, and you don't want that. We always get started our webinars in prayer. So I ask you to please center ourselves and remember that we are in the presence of God. Now, I chose this prayer because everyone, in some capacity, is a caregiver at some point in their lives. Whether you're here because of your connection with Catholic Health Association and your work as health caregivers, or because of your connection to Catholic Climate Covenant and your work as creation caregivers, we welcome you. And this prayer really is for all of us. And in these polarized and precarious times that we live in, with so many of us living in heightened moments of anxiety, this prayer seemed more than appropriate. So, in the name of the Father, Son, and Holy Spirit, let us reflect on what it means to be a healing presence. It is a call to listen more than we speak, to remain calm even when others are in chaos, to stay clear and focused even when no clear direction is apparent, to value people exactly as they are and not as we think they should be, to be with people who are suffering rather than trying to have all of the answers or explain that which is ultimately a mystery, to let go of the temptation to show only the clinical and professional side and hold back the personal and human side of caring. Healing presence is not about doing something. It is about being present. And when we enter this vulnerable state of simply being with another person who is in pain or sorrow, we experience the healing power of God. And so we pray, good and gracious God, you are the source of all healing. In you, we have a share of the wonderful ministry we call healing presence. Today, we pray for caregivers, that your grace moves through each of them to reveal your healing touch, your compassionate glance, your consoling words. Bless them in a special way today and strengthen them so they may continue to be your healing presence to others. We ask this in the power of your holy name. Amen. Today, I'm very, very excited to present with you these four powerful women uh, that are working in the healthcare sector in the United States. I'm going to go ahead and introduce all of them very briefly, and then Indu with a little bit more depth. And then afterwards, Indu will be presenting each of the panelists as they speak. So today we're joined by Indu Spugnardi, who's Senior Director of Community Health and Elder Care at Catholic Health Association of the United States. Lois Sechrist, who is Manager of Sustainability at Ascension. Sister Mary Ellen Licheski, who is System Vice President of Environmental Sustainability at CommonSpirit Health. And Kelly Paul, Supply Chain Diversity, Sustainability, and Education Director at CommonSpirit. Uh, Indu is who I'm going to first start by introducing her, and then she will speak. Indu is, as I said, Senior Director of Community Health and Elder Care at Catholic Health Association. She started at Catholic Health Association in early 2000 as the Director of Advocacy and Resource Development. She has been part of the CH team working on community benefit, palliative sustainability, the We Are Called initiative, and aging issues. In addition, she's led the U.S. Catholic healthcare response to the Laudato Si Action Platform and serves as the co-chair of the Health and Healing Work Group of the platform. I'm also always happy to be able to collaborate with Indu as she is part of one of Catholic Climate Covenant's most reliable partners. So I'm glad, Indu, that you are here. So I will go ahead and stop my share and allow you to get going with your presentation. Indu's going to be really talking about the why of why we're here.
Thank you, pause, and make sure that I'm doing this right, because my technical experience on this webinar so far has not been great. Can you see my slides?
Yes.
Perfect. Thank you so much. And thank you for that introduction, pause. I want to thank the Catholic Climate Covenant for partnering with the Catholic Health Association for this webinar. We're really excited to share the work of Catholic Healthcare with you. For those of you who are not familiar with the Catholic Health Association, more commonly known as CHA, we are the national leadership organization of the Catholic Health Ministry in the United States. And my co-presenters and I are very excited to share with you how the ministry is responding to Pope Francis's call to take urgent action on the ecological crisis. Catholic healthcare in the United States is comprised of more than 600 hospitals and 1,600 long-term care and other healthcare facilities in all 50 states. The Catholic Health Ministry is the largest group of not-for-profit healthcare providers. Every day, more than 1 in 7 patients in the U.S. is cared for in a Catholic hospital. So if the whole Catholic Health Ministry takes comprehensive and collective action on the environment, it will have a significant impact. And today you're going to hear from 2 of the ministry's largest health systems who are leading the way. But before we hear their stories, I'd like to take a moment to make the connection between the ecological crisis and health. In 2021, more than 200 medical journals representing every continent and a wide range of medical and health disciplines published a statement declaring rising global temperatures and biodiversity loss as the greatest threat to global public health in the 21st century. They called on leaders across the world to take urgent action before the changes become irreversible. The journals do note the responsibility of healthcare to take action, and they state, quote, "As health professionals, we must do all we can to aid the transition to a more sustainable, fair, resilient, healthier world. We must join in the work to achieve environmentally sustainable health systems before 2040, recognizing that this will mean changing clinical practice."
Indu,
Yes.
before you get going, your slides are showing with a gray out at the top and the bottom. I'm not sure why that is happening. Um,
Hmm.
so there's a gray out in the top and a gray at the side.
Okay, somebody is raising their
Um,
hand. They might be
and
able to tell me what to do.
it's your Zoom top panel and your maybe the participants on the right, and they show up gray on the screen.
How's that?
No.
Is that better?
That minimized.
Yes, that did part of it, not all of it. It did take the side one, but the top one is still there. But I think the top one should be still okay.
Is
But
that
if you
okay?
maybe go off and reshare your slides.
Okay.
Yeah.
I will do that. Go back and
Sorry about that.
my slide. No, that's okay. I am go back here and
Yep, still that. Do you want me to try from the slides that I have
yes,
available?
that would be great.
Okay, let me bring those up and let me go back to your start. Okay, and now share slides. Oops. Okay, is it better now?
Yes, I can see.
Okay,
Yep.
so you were on this one?
No, I think keep going. One more. There you go. Perfect. Nope, go back one.
Okay, then
All right.
let me know when I need to move the slides.
Okay, go forward one more. Perfect. So the World Health Organization has also declared climate change the biggest threat to human health in the 21st century, and things are only getting worse. The United Nations World Meteorological Organization confirmed that 2023 was the hottest year on record. Climate change affects physical and mental health directly through extreme weather events. Oops, can you go back? Through extreme weather events, heat waves, vector-borne diseases, and pandemics, as well as indirectly as rising temperatures and rain result in uninhabitable areas. The UN predicts 200 million climate refugees by 2050. Further, climate change is predicted to cause disturbances in production and supply chains of food and other products, including healthcare supplies, which can then disrupt the delivery of healthcare. Next slide. In this slide, we see that certain groups of people are at higher risk from the impacts of the ecological crisis. This graphic shows these at-risk populations, along with adaptation measures that can help address disproportionate impacts. When considering the full range of threats from climate change, as well as other environmental exposures, these groups are among the most exposed, most sensitive, and have the least individual and community resources to prepare for and respond to health threats. We could go to the next slide. So let's talk a little bit about the healthcare sector's impact on the environment. The U.S. health sector is responsible for an estimated 8.5% of national carbon emissions, and these emissions stem directly from the operations of healthcare facilities, from purchased sources of energy, heating, and cooling, and most of all from the supply chain of healthcare services and goods. The U.S. health sector accounts for 25% of global health sector emissions, and that's the highest proportion attributable to any individual country's health sector. And in addition to greenhouse gas emissions, the provision of healthcare results in large amounts of waste. On average, U.S. hospitals generate around 29 pounds of waste per day per patient. Also, hospitals use about 7% of all water use in commercial and institutional U.S. facilities. And this is at a time when many parts of the country are struggling with severe drought. We go to the next slide. So what are the imperatives for Catholic healthcare to address this issue? First, from the provider perspective, we are first called to do no harm. We need to address our impact on the environment. We also need to protect those in our communities whose health is being impacted by the ecological crisis. And third, we need to use our voices as experts in healthcare to make sure policymakers know the health impacts and ask them to limit the use of fossil fuels and encourage a transition to clean energy, and to make sure public health, healthcare delivery systems, and communities are provided with the resources they need to adapt to the current and future impacts of climate change and the ecological crisis. We could go to the next slide. And then, of course, there's our mission imperative as a ministry of the church to be stewards of creation. And these points are from the U.S. Bishop's pastoral letter on stewardship, which echoes themes in Laudato Si. One, we are to have a joyful appreciation for the God-given beauty and wonders of nature. Two, we are to protect and preserve the environment. And three, we are called to shield life from threat and assault and do everything that can be done to create communities where life can flourish. And then the next slide, which is the slide that I'll close on. One of the participating in the Laudato Si Action Platform is one way Catholic healthcare is responding to both these imperatives. When the Laudato Si Action Platform was launched in 2021, CHA was invited to serve on the platform's Health and Healing Work Group, and which is tasked to activate the global Catholic health ministry to respond to Pope Francis's call to care for creation. Healthcare was called out as one of the 7 sectors that were asked to participate in the platform. And the 2 systems that you're going to hear from today were the first to join the platform in the United States. And you'll hear how their efforts are meeting Laudato Si Action Platform goals. And I've listed the 7 goals here and some of the related actions that we're seeing healthcare take specifically to meet these goals. So now I'd like to turn things over to Lois Seacrest. Lois is Manager of Sustainability for Ascension. She works with green teams at over 100 hospitals. After 15 years in healthcare sustainability, she has experience in healthy food, waste management, community impact, sustainable purchasing, energy, water, and facility resiliency. She has a background in interior architecture and project management and has taught the leadership in energy and environmental design, which is LEED, Green Associate Exam Preparation course for the U.S. Green Building Council in Missouri's Gateway chapter. And she is, along with Sister Mary Ellen, one of the original members who pushed CHA to get involved in the environment. They're both still here 25 years later. So we have great thanks for all your efforts. And Lois, I turn things over to you.
All right, let me give it a try to share my screen and see how this goes. Are you seeing my slides? Thumbs up. So Paz and Indu, thank you so much for the lovely introductions and for setting the stage for the Laudato Si framework. That phrase does not roll off of my tongue quite as well. I'm not a student of Latin, so pardon me if I don't pronounce that very well. I am very grateful that for the past 13 years, I've had the pleasure of collaborating with faith-based health systems to develop and expand the connections between care of the earth, climate resilience, health equity, and environmental sustainability. So as you can see on the map, Ascension provides care in 18 states in a swath of the Midwest, from Wisconsin and Michigan to Texas and Florida, to over 6.5 million individuals. In our fiscal year 2023, we provided over $2 billion of care for persons living in poverty, as well as other community programs. We committed to net zero carbon emissions and zero waste by 2040 as part of our public sustainability commitments, which include the UN Race to Zero, the U.S. Department of Health and Human Services Health Sector Pledge, and as Indu mentioned, the Laudato Si Action Platform. So as I talk today, I'll explain in more detail what this means and how sustainability is part of our daily work. It is not an added activity. So what is our why? Why is sustainability a strategic priority for Ascension? As outlined in our mission and vision, our initiatives reflect our mission in action to provide care of the whole person, which also sustains and improves the health of individuals and communities. Our values reinforce service of the poor, reverence, and dedication. Our sustainability work aligns with the principles of Catholic social teaching, including rights and responsibilities, fostering the common good through access to food and shelter, education and employment, healthcare, and housing. We give priority to considering the poor and vulnerable in our care, and we emphasize solidarity, recognizing we are our brothers and sisters keepers, wherever they may be. Ascension's environmental impact and sustainability program is organized into the 3 pillars of work that you see here. Net Zero Places focuses on construction and operations of our buildings, as well as using renewable energy sources. Responsible supply chain includes purchases of goods and services, as well as waste management, and a new area of focus for us with clinical sustainability initiatives to involve doctors and nurses and all caregivers in our hospitals. The core of our program is healthy communities, exploring the relationship between sustainability and the social determinants of health, and linking this to Ascension's mission to sustain and improve community health and the lives of individuals that we are privileged to serve. We have 2 bold goals that are the basis for our sustainability program. First, to reduce carbon emissions by 50% by 2030 and to achieve net zero carbon emissions by 2040. Second, to divert 50% of non-hazardous waste from Ascension-owned facilities by 2030, and then to achieve zero waste by 2040 across all of our sites of care. We're reducing emissions by using cleaner energy sources, and then we're diverting waste previously sent to landfills. And by doing both, we're creating environmental and social benefit for the areas where we serve. The external commitments I mentioned just a moment ago support and align with those 2 bold goals. So I will share 2 examples of Ascension's work in our Healthy Communities pillar of work. First, I'll discuss our emergency preparedness and our climate resilience activities. Second, I'll discuss a current project we have to improve access to healthy food, which improves health equity and supports human flourishing. So, in our community resilience planning, we've specifically focused on environmental factors such as fire, flooding, heat, and storms, knowing that building resilient communities leads to health equity and environmental sustainability. As we've already discussed, and Indu had some really excellent illustrations for this as well, climate impacts affect many of the communities Ascension serves, with a more significant impact on individuals who are poor and vulnerable. We're seeing weeks of extreme heat days in Austin and intense rain events due to increased atmospheric temperatures in Nashville. As oceans absorb heat, hurricane seasons are starting earlier and becoming more severe, as we saw this fall, as the 2 hurricanes moved through both Florida coasts and up into Georgia and North Carolina. The social determinants of health that we've already mentioned include healthcare access and quality, education access and quality, social and community context, economic stability, and neighborhood and built environments. Those are the lens that we use to identify and address the 80% of non-clinical factors that determine whether a person has good health outcomes or not. And you can see that in the diagram on the right side of the slide. This includes individual behaviors. Do you smoke? Do you exercise? Social and economic factors. Did you receive a good education? Do you have a safe place to live? Do you have reliable and safe transportation? And then our built environment. Do you live in a polluted area, or do you have access to clean air and clean water? If those needs are met, the health and well-being of individuals and communities is improved so that our clinical care can have the most impact on that 20% of the pie chart that you see on the screen. This summer, Ascension published its Climate Resiliency Plan. On the cover of our report, you can see Hurricane Michael, which hit the Florida Panhandle in 2018. Due to our well-prepared emergency information, we did not have to evacuate our Sacred Heart Bay Hospital, while others in the area did not have quite the detailed information that we had, and they did evacuate. So we were able to continue to provide care and know that we were able to do it safely. Ascension assigned the U.S. Department of Health and Human Services Health Sector Pledge in the initial cohort, which was announced on Earth Day in 2022. The pledge has 3 parts. First, reduce emissions by 50% by 2030 and achieve net zero emissions by 2050. Ascension plans to do this 10 years sooner, by 2040. Second, designate an executive responsible to manage and reduce carbon emissions. We've done this through guidance from our Sustainability Steering Committee. And then third, develop a climate resilience plan, as you see here, anticipating the needs of our communities that experience high risk from climate-related harm. We're using lessons learned from those extreme weather events to ensure that our acute care hospitals are resilient and are available as a place of both treatment and refuge, 24 hours a day, 365 days a year. We have a comprehensive emergency management program tailored to each region that we serve. We partner with federal, state, and local agencies to maintain full services at our sites of care. Common occurrences that you can see on the slide, such as high heat and flooding, are also threats to human health. Stress and mental health concerns are experienced by people exposed to pollution and severe weather. As we understand those factors affecting those who are at high risk for poor health outcomes due to fire, flooding, heat, and storms, we're able to identify vulnerable populations, educate our communities, and develop action plans to mitigate the impact of intense weather events. We developed a tool to help our individual markets understand the resources available to them to support their communities and to be prepared for those severe weather events. First, we identify which communities have their own climate action plans, such as Indianapolis, Austin, and Chicago, so that we can align with those priorities. Next, we provide contact information for local government and local agencies, as well as links to each location's emergency plan and the hospital's safety officer. The Community Health Needs Assessment is a detailed plan developed on a 3-year cycle, which includes unique information developed for each location. Finally, we provide a glossary of terms, since not everyone is familiar with our lingo of emergency preparedness and sustainability. The audience for this work is our advocacy, our community impact, and our community benefit teams, who are essential to building those community relationships. Next, I'm going to pivot to talk about our work with access to healthy food. Ascension joined the White House commitment to end hunger and build healthy communities by 2030. This work will focus on identifying and addressing those social determinants of health needs, with an emphasis on high poverty and vulnerable communities. Since 2021, Ascension invested in food and related initiatives equivalent to 80,000 individuals served across 11 states with the value of over $1 million. By 2030, in partnership with our foundation and our community investment strategy, we plan to double those funds. We created a food insecurity work group, and we partnered with our food service provider to create a farmers market program focusing on our hospitals that are located in low income, low access food areas, such as the city of Milwaukee and the city of Detroit, where we have hospitals in those areas. The markets sell fresh produce and provide healthy food options to associates and visitors at reasonable prices, with a goal to understand and then remove those barriers that lead to food insecurity. These can be things such as not having a car, no time to cook from scratch, work hours that prevent going to a Saturday morning farmers market, and income restrictions that make fresh produce unaffordable. In addition to the in-house farmers markets, Ascension dietitians developed healthy recipes using that seasonal produce that people might not know how to cook. And then they prepared the recipes for participants during teaching kitchen classes. Finally, I'd like to close by sharing Ascension's Environmental Impact and Sustainability Report that we published this month in connection with the Feast of St. Francis. In the report, we share the framework of Ascension's program and our sustainability activities from the past year. So we've done this report every year for 13 years. This has been my pet project every year, and we're very proud of it. We reach out to both associates new to the program and to those that have worked with us for years, with both entry-level and also in-depth stories and data. If you'd like to learn more about our sustainability projects, please visit the webpage that I'm showing here, and also contact me at my address shown on the slide. And now I'm happy to turn it over to Mary Ellen.
Thank you, Lois. I'm going to do some brief introductions for Sister Mary Ellen and Kelly Paul, who are both from CommonSpirit. Sister Mary Ellen Lechieski is an Adrian Dominican sister and System Vice President of Environmental Sustainability for CommonSpirit Health. She's responsible for overseeing system-wide environmental sustainability initiatives. In conjunction with her work in sustainability, Sister Mary Ellen facilitates communication networks among her colleagues and works closely with hospital systems and environmental organizations throughout the country to address healthcare's impact on climate and the environment. And she promotes programs that proactively address issues of sustainability. Currently, Sister Mary Ellen serves on several national boards, including the board of the Catholic Climate Covenant. And I'd also like to introduce Kelly Paul, who is System Director of Diversity, Sustainability, and Education in CommonSpirit Health Supply Chain Team. Kelly joined CommonSpirit in 2018 and is the Scope 3, she'll tell you what that means, greenhouse gas emissions leader for their Climate Action Plan. Kelly's responsible for CommonSpirit's supply chain, sustainability reporting initiatives, oversees sustainability alignment with the department's strategies, and serves on a variety of collaborative groups with other leaders in healthcare sustainability. So, Ms. Sister Mary Ellen and Kelly, I'd like to turn it over to you.
Great, thank you very much. And Lois, really nice job. Thank you for that. And thank you, Indu, for this invitation and Paz to be with you all today. I work with our hospitals to help make the shift from doing little or no harm to healing those we serve and the planet that sustains us all. So I'm delighted to be with you today and with my colleague, Kelly Paul, as we just lift up some of our sustainability efforts, the why of those efforts, and highlight steps that we're taking to reduce our greenhouse gas emissions, especially in the area of supply chain. My remarks today come from my experience working specifically within the Catholic healthcare system, but no matter what sector you represent, there are elements that are common to us all. So I hope you find these comments helpful. Next slide.
Hold on.
Okay.
It's giving me issues.
I can do that.
There we go.
There we go. Thank you. So here's a little background of who we are. CommonSpirit was formed in 2019 with the alignment of two healthcare systems, Dignity Health and CHI, Catholic Health Initiatives. We're a sprawling organization delivering clinical excellence across a system of over 150 hospitals and 2,200 care sites in 24 states. Most of our hospitals, but not all, were founded by women's religious congregations. So our commitment to sustainability comes from the sisters who, together with doctors, nurses, and caregivers close by their side, left us an incredible legacy of healing, calling us, challenging us to continue to deliver on our healing mission in ways that uplift and sustain all life. Next slide. So I'd like to touch just briefly on some of the reasons we are on this path to sustainability and net zero. The first is that providing care to our communities and planet is integral to our mission. It's an extension of Catholic social teaching, which recognizes the dignity of our brothers and sisters around the globe, as well as here at home, our dependence on one another and Earth, and the well-being of future generations. Next slide. Another reason is that as healthcare providers, we pledged to first do no harm, and yet our greenhouse gas footprint is significant. Worldwide, the healthcare sector is responsible for almost 5% of total greenhouse gas emissions, and the US healthcare sector contributes about 27% of greenhouse gas to the world's healthcare-related emissions. Now, the emissions are driven by the fact that we have high standards of care. Hospitals operate continuously, 24/7, consuming huge amounts of electricity. We generate billions of pounds of solid waste annually, and we have complex supply chains that rely on extended distribution networks. Next slide. Another reason is that as emissions increase, human health suffers, and no one is safe from the impacts of illness related to extreme heat, like stroke and dehydration, air pollution, which can result in higher rates of asthma, respiratory, and heart disease, vector-borne diseases like malaria, dengue, and Lyme, and extreme weather events, which can cause injury and death when power is knocked out, when homes and bridges are damaged, people get separated from their medicine, food, and water, or just don't have access to medical care, and the anxiety or grief following weather-related disasters. Next slide. And some face greater risk than others: communities of color, low-income communities, young kids, the elderly, people with underlying health conditions and disabilities, agriculture and construction workers, and they're the ones who are the least prepared and have the least resources to cope with these extreme weather events and health threats. Next slide. So for CommonSpirit, this is a health equity and a health justice issue. Next slide. And so another reason we're on this path is that according to the annual Gallup poll, doctors and nurses are found to be the most trusted professions. They're uniquely positioned to lead the charge in educating the public about the connections between climate and health. So if we're going to heal our wounded world, the strength of their voice is absolutely critical. And finally, scientists have made it pretty clear that this decade is crucial. We are making strides toward a sustainable future, but it just isn't happening fast enough. So organizations who are able to reduce their greenhouse gas emissions should do whatever they can to pick up the pace. Next slide. Some steps that we're taking to weave sustainability into the fabric of our work include focusing efforts on our waste practices so that we don't contaminate the communities we're committed to serve. And we all know this is an ongoing challenge. Working towards ensuring that the chemicals in our products don't harm our patients, staff, or the vulnerable communities where they're manufactured. Reducing the amount of food we waste, If there is an excess, we collect it and share it with shelters in our communities. And some of our facilities have created hospital gardens that provide produce to our patients, staff, and communities. Another step is supporting economic growth in our communities by increasing our spend with minority and women-owned businesses and building community wealth, supporting public policy leaders as they advance meaningful climate solutions at all levels. And work is underway to make sure that our communities and buildings are resilient in the face of extreme weather events. We really need to stay open so we can be there for one another. I think one of the most important things any of us can hear in times of crisis is, we're here for you. We're not going anywhere. And paying attention to my daily choices, our daily choices, what I purchase, what I eat, how I travel, and just keep asking the question, who is this impacting now, and how will it affect those who come after me? Next slide. And so in 2021, we developed a climate action plan, which is a framework for reducing our greenhouse gas emissions and exploring ways we can lessen the impacts of climate change in our communities. We've committed to reach net zero greenhouse gas emissions by 2040, with an interim goal of cutting operational emissions in half by 2030. Next slide. The plan consists of 3 pillars. Buildings and operation is the first, and this accounts for about 25% of our total emissions. Here, we're setting standards for building performance, making sure our equipment is running at peak efficiency, improving insulation, reducing energy leakage, incorporating energy efficiency into new construction and major renovations by converting to LED lights, which keeps our facilities cooler and brighter. And that means we're using less air conditioning, and our physicians, nurses, and staff are more comfortable. Adopting a renewable energy strategy, we will be implementing a number of different solar arrays across our footprint, installing additional EV charging stations across our system, and work is underway to decrease the amount of nitrous oxide we waste by changing the delivery system. More solar, better and more efficient equipment, and less fossil fuel means less heart disease, asthma, and other lung conditions. And it also means less air and water pollution. The second pillar is supply chain, and Kelly will be speaking about her team's activities in just one moment. And the third pillar refers to climate resilient communities. The impacts of climate change are showing up in the health conditions of our communities. So there's work underway to establish community partnerships to build climate resilient infrastructure and programming and influence change through public policy and shareholder advocacy. So these are some of the ways we're taking care of each other and just helping to make sure that the planet is livable for everyone. So I'll hand this over to Kelly right now to talk about the activities and the challenges that are related to supply chain. Next slide.
I think Kelly's presenting with her slides.
Great.
Oh, you do need me to present. Okay, give me just one moment then, pause.
Yes.
And thank you very much, Sister Mary Ellen, for reviewing CommonSpirit's approach. I am honored to be here today to present to you all and just share a little bit about how we're addressing climate and health impacts through purchasing and supplier engagement at CommonSpirit. Okay, I believe you should see my screen now. Okay, wonderful, thank you. All right, so at CommonSpirit, sorry, I'm getting a pop-up here. Okay, so at CommonSpirit, when we calculated our baseline emissions in 2019, We found that the scope 3, which isn't all supply chain, but that's where the supply chain component lives, is within scope 3, comprised about 75% of CommonSpirit's greenhouse gas emissions footprint, which is really in line with industry kind of percentages that you see. So while not surprising, understanding that we have a lot of work to do really in this space. So when we broke that down, 3 of CommonSpirit's most material scope 3 categories are purchased goods and services that we use in our facilities, our capital goods, so large equipment, a lot of the things that go into our built space, and then the upstream transportation and distribution of those goods and services. So we have 3 milestone goals really that will help us get to a net zero for our scope 3 emissions, but it all has to do with working with our vendors and the purchasing decisions that we make as a healthcare system, and then how we collaborate with others across healthcare to make sure that everybody is able to achieve the same kind of progress. So by 2025, we're looking to have our top 30 healthcare vendors committed or having set science-aligned targets for their own organizations. 2030, 5 years later, we're looking to have engaged the top 67% of vendors. That's more than 10 times our 2025 goal. So the work that we're doing today is really, think of it as a pilot, and then we have to just really expand this approach so broadly to get there. And then by 2040, achieving at least 90% absolute reduction in our scope 3 emissions. And over 3 years of tracking, we've seen vendors submitting to and being scored by the Carbon Disclosure Product, or CDP, as well as those committing to and setting targets through science-based targets. You can see each year we've seen a great increase in those being submitted and scored, or committed and with targets set on the science-based targets component of that. And although these numbers are improving, which it's going in the right direction, we really must continue to advance our strategies to connect with our vendors over time. This is really a long journey, not a quick solution. We need to continue both engaging those who are really excelling and leading, as well as those that need extra support to meet our climate action plan goals and to have the impact on healthcare that we are seeking. So one of the big things that we've been doing is supplier engagement. And since we started on the Climate Action Plan journey in 2021, we have engaged just around 100 vendors. And as I stated before, that's going to expand enormously as we continue working toward our 2030 and eventually our 2040 goals. Of the vendors that we've engaged to date, we've had a 100% response rate to our initial communications, a vendor letter, letting our vendors know what our goals are, what our expectations are, how we can do this together, and a questionnaire that we sent out to understand our baseline. But it didn't happen easily. It took a lot of persistence, a lot of partnership, and it's not a one-time thing. It's really ongoing. One of the challenges in this space is that not all vendors are ready to take action. And so we continue looking at how we can prepare more vendor partners to act. We've also had a lot of direct conversations with vendors to talk about our expectations, find shared goals, and discuss some potential solutions or how we can really increase what we're already doing together. And one place that we've really had a lot of impact in is in participating in semi-annual business reviews with our supply chain leadership and vendor leadership with several of our largest spend healthcare vendors to discuss what their efforts are to decarbonize, look at their sustainability strategies, and see what we can advance together. And while engaging with our vendors to set science-based targets, it's really a key aspect of our supply chain strategy. Implementing everyday solutions across our facilities is another very impactful practice that we're very committed to. So I just wanted to give you a little bit of representation of some of the main categories where we're implementing solutions across our system. So we look at ways that we can reuse items within our facilities, often involving a sterilization process to be able to reuse those items with the next patient. Reprocessing, where we collect items that can be reprocessed. And then another important piece is purchasing those reprocessed items. They have to have someone to use them to make the reprocessing value. So plenty of areas that we're doing that. Recycling, such as with our sterilization or blue wrap collections, so that they don't just end up in the landfill. Avoiding chemicals to begin with. So we've been doing a lot of work on PVC and DEHP in areas like breast pumps and accessories, exam gloves, in IV bags and tubing. And I'll talk more about that last one here in just a moment. And then we're well underway on reducing our inhaled anesthetic gas use, nitrous oxide, desflurane, and the others that we know have an enormous impact on global warming. And then looking at the 5 chemicals of concern in furniture and furnishings, such as flame retardants, and again, the PVC and DEHP and other chemicals that we tend to find in chairs and beds and dividers and all sorts of built environment pieces. And then on food, local and sustainable purchasing. And really, I just wanted to highlight that this effort to identify and actually enact these opportunities, it's such an ongoing process, and it does involve so many stakeholders. Our business units like supply chain, real estate, services, and then, of course, our clinicians and physicians at the facility level. The alignment is really key to implementing these changes and making sure that we have consistency across our system. And again, we're really committed to making our facilities healthy environments, not only for patients, but also for our staff that come to work there every week. And then finally, I wanted to leave off by highlighting a recent example just to demonstrate the power of collaboration in this work. It's a completely different experience, I can say, to try and do something in isolation versus really leaning into the others that are invested in this work and can help us expand this across healthcare. So when we partner between sustainability leadership, advocacy leadership, and sourcing leadership, just to name a few of the key players, we bring together this knowledge of the environmental and health impacts. We bring together the expertise with developing laws and national level efforts that are underway, and then the purchasing, the decision-making, the vendor relationships, and we bring this all to the table. And when we do that, we're able to experience authentic leadership and increased impact in any strategy that we're trying to implement. So recently, as leaders in these areas, we took this approach regarding the elimination of DEHP, which is a softener for PVC in IV bags and tubing, as we watched the progress of Assembly Bill 2300 in California to remove the chemical DEHP from those products. And this isn't new work for CommonSpirit. These are conversations that we've had in the past with vendors that continues to come forward. And by collaborating with multiple internal stakeholder teams, what we were able to really do is understand this as an issue from various angles, many lenses, like CommonSpirit's mission, our purchasing needs, our vendor relationships, and the public advocacy space. And by leaning into each other around a common goal and spending time understanding really the sum of our needs and the sum of our actions around this issue, we've each been able to then show up authentically and informed in our conversations that we're having. And as a result, we've had very meaningful dialogue with our vendors in this space, and we've been able to generate awareness and accountability across our organization, not just the purchasing decision makers, but also working on the road to help make sure our clinicians, our physicians, others understand the true need to change in a space like removing the DEHP from those IV bags and tubing. So just one example, I continue to be humbled by being a part of this work, the amazing individuals at CommonSpirit, at Catholic Health Association, and our other healthcare providing organizations that we're able to partner with and see the impact that we can make in this space. So thank you for having me today.
Wow, thank you, Kelly, Sister Mary Ellen. It's amazing. And Lois, you all are hearing the best of the best. So we have a few minutes here. So pause. Is it okay if I kind of pose a broad question? So you both all of you are from two very large healthcare systems. You probably have to change lots of hearts and minds to get to the point where you are. So I want to take a question that came in the chat about this person asks, do you find differences, challenges to achieving your goals in states or dioceses that are less environmentally active? And I'll even say maybe opposed to working on this issue, but maybe you can talk about how you use mission, Laudato Si, to convince people internally and externally that this is important work that is good for everyone.
You know, I think one of the things, Indu, that we do, as you say, is always going back to mission. That's the cornerstone, and then going to our health as well. I mean, that is something that everybody wants, is good health for their family, for their kids, for their grandkids. So when we look at what it is out there that is causing harm to ourselves, to our planet, to other species as well, we all have to look at what is good for us, for our health, and what is it that we can do? What's our responsibility to do in order to make that happen? So it goes back to health.
And for us at Ascension, we are in the Midwest, and it is very conservative, and we do not have the benefit of very many ordinances or regulations. So yes, we speak to our mission, care of the earth, yes, providing better health outcomes through the work that we've done, and that is very, very helpful.
And there was a question or a comment, how do you respond to those who are more concerned about economical advantage than environmental goals? And I think you touched on this. Treating poor health outcomes is very expensive. So Marie Ryan has a raised hand. Do you take
No, we
questions?
ask that they put their
okay.
the comments in the Q&A. Yeah.
Okay. Any other closing remarks? Kelly, Lois, or Sister Mary Ellen, you're speaking to kind of this whole range of the Catholic health ministries, from religious orders, schools, universities, social agencies. Is there work that you're doing that is relevant and can be shared in their scopes of influence?
Yeah, I think that I would just say that, again, going back to the faith, which our founding congregations experienced years ago, I think is still at work in each of us, and it's working just as powerfully. So I think it's like a thread that has been present all these years, carrying us, even though we may or may not see it. But if we have the responsibility now to accept that challenge to deliver on our healing mission, and there were challenges back then. There are challenges now, and they seem, pretty powerful challenges. But I think it's just having the faith that we can do this. And I like Pope Francis's Laudato Si Action Platform, because it talks about doing it together. We can't do this alone. It's only together.
I'm going to have to come in and close us out. We could probably stay talking for another few minutes, but I do want to end it too. I want to thank our panelists. Thank you all for being here and sharing your wisdom and information. If folks have more questions, write to us at info@catholicclimatecovenant.org, and I will then pass them on to the person that your question is for. Or if you need more details, I can pass them on also to Indu. Thank you all for being here today as attendees. You will be receiving the recording as well as the slides in the next 24 to 48 hours. Well, for now, thank you very much, everybody, especially all four of our panelists. And thank you, Indu, especially.
Well, thank you to Catholic Climate Covenant for having us. Thank you so much.
Thank you. Take care, everybody.
Thank you. Bye.